Have you ever visited the hospital and only to be told by your doctor that the very condition which you've been managing 2 months back is the same condition that is still troubling you? Hello and welcome back to Bulamu Podcast Talk Show. Still, I'm your host, David Nyamurangwa, and today is our next episode. Today we are going to be talking about another health topic. It's about antimicrobial resistance. By the time I leave here, I want everyone to be able to understand what is antimicrobial resistance. When I talk about antimicrobial resistance, what is it all about? Antimicrobial. So when I say antimicrobial, so I mean the drugs that help us to fight the different microorganisms. For example, when you hear people talking about antibiotics, so these are the medicines or the agents that we use to treat the bacteria. Similarly, we also have other microbial agents, for example, antifungals. So these are the ones that help us to fight the fungal infections. We have antiparasitics. Also, these ones help us to fight the different parasites. So what is antimicrobial resistance? When you talk about antimicrobial resistance, is where you have these different antimicrobial agents, or the antibiotics, the antifungals, the antiparasitics, all of them failing to do the work that is supposed to be done. So the simple antibiotics or the simple antimicrobial agents, later on you find they are failing to do the work that they are supposed to do. So briefly, that's how I can be able to explain what antimicrobial resistance is all about. And what I want to tell you is it is a silent global burden. Actually, we should even call it the next pandemic, global pandemic, because many people out there are dying because of this condition or because of this burden that is affecting people without knowing. And the funny bit is, most people are contributing to this burden without even knowing. So when I talk about everyone is involved in this burden, I will talk about the patient. You as a patient, you have a contribution to this burden. As a health worker, as a MSAO, you also have a contribution to this burden. The farmer out there who is planting kasori, who is planting maize, you also have a contribution. What about the environment that we live in? There's something that is being contributed from this environment that we have. I'll give you a simple scenario. I stay in Kalero here. We have a lot of people who sell chicken. So let's say we have a farmer who is rearing chicken, a poultry farmer who is somewhere, some distance away from Kampala. So this person rears about 2,000 chicken. So as he's rearing this chicken, you expect three things. First, he's going to be producing chicken, which will supply around Kampala. We shall expect him to produce a lot of manure, the manure produced from the poultry farm. Then another thing, we expect him to produce maybe the eggs that are going to be eaten by the people around Kampala. So now, when this chicken falls sick, the chicks fall sick, this farmer runs to a nearby pharmacy and buys maybe an antibiotic, let's say amoxicillin or ciprofloxacin. So when he gets this medicine, it is the medicine that is given to the birds when they fall sick. Maybe they've gotten a flu, or maybe they are having a fever and maybe looking a little bit sick. So he uses these antibiotics to make sure that the birds get better. And he has not done it once, he has not done it twice, he's doing it on a daily basis. The medicines that are being used by humans is the very medicines that the farmer is using to cure the birds that is reared. So now what happens is, now when these birds produce the waste from their bodies, this waste is going to be used as what? As manure for the farmer, or the very farmer is going to transfer this manure and put it in his vegetable garden. So now, let's say now the bacteria which was being treated in these birds has become a little bit resistant. And now this same bacteria has become a bit resistant, and now it is being transferred into the waste that is being taken into the garden. Later on, you realize that the farmer who is doing this mulching, is putting this manure, is going to start supplying this vegetable that is supplying to the nearby places. So the people will start to consume the vegetables. Remember, the manure being used in this vegetable garden has come from the poultry farm. The poultry farm. The poultry farm, remember, they could have also acquired a resistant strain of bacteria. So it is being transferred. Even sometimes when it rains, this very waste can run into the water bodies. So somewhere, someone is taking the water that has run through the farmer's garden. So later on, you'll find that it's very challenging when now a person falls sick, is going to have acquired the bacteria. Now, treating this person when he goes to the hospital will have acquired a very resistant strain of bacteria. So the health worker or the doctor is going to start using the medicines that were used in treating the birds. So now, when he uses these medicines to treat maybe a UTI, which this person has acquired, it's going to be very resistant. And the person will take longer to get better. So you find yourself wasting a lot of money to treat a simple infection like a UTI, maybe or a simple cough that should have gotten better in just 3 days. So now it is taking 2 weeks to get better. You're taking a lot of time. You're using a lot of money to cure just a simple infection. Or sometimes we have longer hospital stays for someone who gets a severe infection. So you can see that it's something that is interlinked. You have a farmer who is rearing poultry. We have someone who is doing gardening, planting greens or cabbages. So we also have the people who are eating all these supplies from the poultry farm and from the garden. So at the end of the day, we are getting a resistant bacteria, which becomes very challenging to treat. So it's very challenging at the time where you find that the simple medicines which you would have used to cure the bacteria, it becomes a very big challenge for the whole community. So that's how it becomes a big burden for all of us. Yes. So how does the patient also contribute to this challenge? We have people who do self-medicate. Someone, because you felt you have a fever, you have maybe a headache, you run to a pharmacy and buy an antimalarial. And in real sense, it was just maybe a flu, which you were supposed to be cured by just maybe taking water or maybe just having a simple rest and the headache goes. So you subject yourself to a lot of antibiotics or a lot of antimalarials. And now by the time you get the same infection, you find yourself having a challenge because the medicines that you used the other time will not be able to help you this time around. So as a patient, you also have a contribution to this burden that we're talking about. Then how about the health workers? Health workers, we also have a problem, especially in the way how we handle the medicines. You find the health worker prescribing like 5 different antibiotics for the same person. When I was practicing, I remember they used to tell us that you are not supposed to exceed 3 antibiotics, 3 medicines actually. For the patient you get, don't exceed 3 medicines unless it's maybe a challenging condition where you have to combine different medicines. So that one will give us an alarm or to always challenge us to always limit ourselves in the number of medicines that we issue out. So we have what we call overuse of antibiotics or antimicrobials. We also have underuse. Sometimes you get a child who you're supposed maybe to give 2 tablets and you end up giving only 1 tablet. So in that case, you'll have underdose. Someone who was supposed to give the rest medicine, you've given an underdose. So that person will not get better. And what happens is the bacteria becomes more smarter. So the time you want to use that same medicine, it will not work for that individual. So that's how challenging it is for real to deal with this burden of antimicrobial resistance. Then I want to shed a light on the burden or how some of the statistics. I may be talking about all of this, but you don't understand how many people are dying all over the world and also here in Uganda. Some statistics. Globally, we have over 5 million people who die because of antimicrobial resistance. and over 1 million people die because of antimicrobial resistance or antibiotic resistance. Yes, so that's how the challenge is all over the world. Now, when we come to Uganda here, we also have a very big challenge. A very big challenge. For example, in 2021, we had almost 5,602 people who died because of conditions that are associated to antimicrobial resistance. So you can see the number of people who died in just a year. All those people died in just a single year. So many people are dying out there because of this burden. So it's our responsibility. Not only the responsibility of the health worker, it's a responsibility of the community member. You as a patient, you have a responsibility. As a farmer out there, don't just buy those antibiotics for your animals. Don't just buy them thinking they're going to help you, but you're causing a lot of risk for the people that will consume the produce that you put out in the market. In the environment, there is a lot that is happening. People just throw medicines in the community. You just buy maybe amoxicillin, you just, after maybe swallowing like 2 tablets, the remaining, you just throw them in the environment. So now the bacteria which is exposed to those antibiotics in the environment, they become very, very resistant. And the next time you want to treat a given condition that would have responded to that antibiotic, you'll find yourself taking longer to get better. That's very, very challenging. So what is our responsibility as health workers, as patients, as community members out there? First of all is we need to create awareness. And this is the very thing I'm making here. I'm creating awareness so that you understand the burden, understand the challenges that are associated with antibiotic resistance. So you need to become a champion, become an antimicrobial champion, antimicrobial resistance champion. Like myself, I'm very passionate about creating awareness about this situation. As I told you, it is a global burden. And also, it is estimated to become a pandemic in years to come. So that is awareness. The next thing is we need to be able to use these antimicrobial agents responsibly. Don't just buy any medicine without understanding the root cause of the condition. As a patient, go to the hospital, go to the health facility that is next to you. Ask the doctor to understand and be able to give you a prescription for the condition that you're suffering from. Don't just rush to the drug shop or the pharmacy and buy medicines anyhow. Yes. Then as a health worker, please, we also have a responsibility to make sure that we prescribe the right medicines in the right quantities at the right time. So all that need to be put into consideration. Then also we have the way how we handle these medicines. When you're given these medicines, make sure that you swallow the dose as it is given to you. Don't just swallow 2 tablets or 3 tablets just because you felt you're better, then you throw away the remaining medicines. That is very, very bad. Then also, we need to make sure that for the farmers, make sure that you don't use medicines that are used for humans, you use them for your animals. Some people just buy antivirals, antiretrovirals, medicines used to cure or to manage HIV. They use them in managing or in pigs. I think you've heard of those scenarios where they use antivirals, those medicines that are used for managing HIV in pigs, that they help them to fatten. So that is very bad because there is a risk that is posed. The more you use those antivirals, it becomes challenging for the people that are using those medicines. The viruses become a little bit smarter, so there is a lot of resistance that is created. Then also this goes to the stakeholders. The stakeholders, those are the people in the government, those are the people in offices, places of leadership. People need to, there's a lot of sensitization that needs to be done. So we need to come up with strategies on how to reach out to people, to inform them. We can have different activities going out in communities to create awareness. Not only that, we need funding. There's a lot of funding that's needed from these officers, from the government, right? To make sure that people are aware on how to use the different medicines out there in the community. There is a lot of funding that is needed. Yes. So besides that, I want you to understand that microbial resistance is a very big challenge, and it takes me, it takes you, it takes everyone out there to be able to control this burden that we have in our community. Because if you don't do it, then who else is going to do it? Hmm? Everyone has a role to play in fighting this crisis that we have in our community today. You may not understand it now, but later on, when you go to the hospital and your doctor tells you that you have a resistant strain of bacteria, they have used all different kinds of medicines, and you're not getting better. Eh? So you find yourself spending a lot of money on a simple condition which you would have gotten better in just 2 days. You'll find yourself staying in hospital for long just because of a mistake which was done by you, by your neighbor, by anyone in our community. You'll find yourself a lot more stressed because there's a lot of stress that comes with this kind of crisis that we have. Even the country itself, imagine where we have everyone having resistant strains of bacteria in his body. Hmm? So the country will have more people dying. More people will be dying each and every day. So as a country, there is a challenge that is being reflected in the statistics. So it carries all of us to come up with measures. It carries all of us to create awareness. It carries all of us to be vigilant in the way how we handle the different medicines. Because I want you to understand a time where you find yourself, there's no medicine that can work on you. We've looked for all expensive medicines because in treatment or in medical field, we have what we call the lines of medicines. We have the first line, we have the second line, we have the third line. So when you come to the hospital, what we do, we give you the first line of the medicine. So when you fail to respond, that's when you can try to upgrade and go to the second line or the second generation. Okay? So when that fails, we go back to the third generation or the third line. So the third line, we always reserve it for people who have those resistant or very severe conditions. So they are called life-saving medicines, where you've used all the first line and the second line and they have failed. So I want you to imagine a situation where even the third line, even the fourth line, now if we bring the fifth line, it has also failed. So what will happen? Everyone will die. So understand it from that perspective, where you find yourself, you can't have a single medicine that can cure a simple cough that you have. So that's how very crucial it is to be able to handle these medicines with a lot of care, with a lot of caution. Become a champion. Become an antimicrobial resistance champion. Out there, wherever you are, you have a role to play. There's something that you can contribute. Something that you can play to make sure that we control, we limit this burden from spreading all over our communities. Thank you so much. I believe you've been able to learn something. And please make sure to comment, make sure to share your experience. I believe you have conditions that you've managed for months and months, years and years, but you're not getting better. Please share your experience so that people can be able to understand how troublesome this antimicrobial resistance is in our communities. Please comment, share, follow, so that you'll not be able to miss out on similar content. I've been your host, David Nyamurangwa, and I sign out. Thank you.